We wanted to thank you all for joining us this evening. My name is Michelle Ritter, and I am a member of Mercer Island Parent Edge. And we are part of the Mercer Island PTA Council and supported by all of our local PTA units. And we are very glad that we can bring this program to you tonight in partnership with the Islander Middle School Counseling Team. This is a really important program, and we know that all of us have faced challenges over the last year. And so this topic is really important for us to have a discussion and find out how we can talk to our kids and be prepared. So when we need to have those difficult or important conversations, that we are prepared. And so I'm going to turn it over to Harry Brown. I just want to mention real quick, we are recording the program. So if you know someone who wanted to attend and wasn't able to join us, we will be sending out the recording. If you have questions, if you can please list those questions in the chat. And if you would prefer to ask the question anonymously, you can send it to to Parent Edge, Michelle, and I can ask the question on your behalf. So I am going to turn it over to Harry and his team. And Harry, if you want to introduce your group, and we'll get started. So thank you all again for joining us for this important program.
Terrific. Thank you, Michelle. And we really appreciate Parent Edge creating this space for us to share this important information with you tonight. And this program, Signs of Suicide, the Youth Suicide Prevention for Parents, is a program that is different. You may have attended the program we did from Forefront in the fall that focused on the Learn curriculum. And just some context, that program is really specific to high schoolers. And so our effort is really focused on how do we support our middle schoolers with the best practice program. And you go to the next slide, please, Michelle. And that's the SOS program. And you'll hear just some differences. There we go. And this is really focused on helping your child save a life. How can they recognize when a friend needs help? And also to translate that, how can you support your child and help them help themselves if they're having a challenge as well? The program was sponsored by Mercer Island Youth and Family Services, and we were able to pay for this with the Healthy Youth Initiative grant. So I really appreciate YFS and our admin team there in supporting our efforts at the middle school. So as Michelle said, my name is Harry Brown. I'm a licensed marriage and family therapist, and I've been at IMS for almost, it's 20 years now. It's amazing. I've been there that long, and I really enjoy it. I was in community mental health prior to that. I'm also a coach for Forefront for high school teams and do trainings and help develop curriculum to train our counselors and counselors all over the state of Washington on how to recognize and prevent suicide and do safety planning intervention. And that's something I'm grateful that we have. We utilize that at IMS, and now it seems to be more important than ever. And I'm going to pass it on to the next member of our team, and I'll let you go ahead, Audrey.
Hi, I'm Audrey Phillips, and I'm in a graduate program studying to be a marriage and family therapist. So I'm an intern right now at Mercer Island Youth and Family, working with the youth and families of Islander Middle School.
Hi, my name is Drew Klein, and I'm one of the counselors at Islander Middle School employed through the school district. And so because we're employed through the school district, we also break up a caseload. So I work with families whose last names start with A through G.
Hi, I'm Janet Goldstein. I also work for the district, and I work with students and families whose last name is H through O.
And I'm Jana Dash. I'm at the end of the alphabet working with families last names P through Z.
You're muted.
We can go to, yeah, I got it. We go to that next slide. Thank you, Michelle. So suicide can be really a challenging topic for everyone. And we add the animation to this. So next click. And want to really reinforce it. Take a break if you need one. If you need to turn your video off or just get up and walk around, really appreciate that. And also to get support for yourself. If something we talk about tonight resonates with you and you have any questions or concerns for your child or for a friend of theirs, or even if you need support, you can contact any one of us. And the one thing I really appreciate and that's kept me at IMS so long is the incredible collaboration I have with the rest of these people on the team. And I need to acknowledge, even for myself, this can be a difficult subject. I'm what people call a survivor of suicide, 45 years, coming up on the 45th anniversary of my own brother's death by suicide. And that's one thing we talk about too, is we don't talk about people committing suicide because that has the stigma associated with it, as if it's some sort of crime, where we know this much more complicated, often connected to mental health issues. So tonight we're really going to try to refer to this as someone dies by suicide or passes, or death by suicide, rather than committed suicide. And hope you can use that language as well, as we just don't know. We know many people have been impacted by this, and it's really the respectful way, and it's a bit of a paradigm shift that the folks at Forefront are working on, and suicidologists all over the country talking in those kind of terms. So these are a couple of resources for you. The Suicide Prevention Lifeline, incredible resource available 24 hours a day, and connects also to our King County Crisis Connections folks. And then there's a crisis text line. It's interesting, some youth, I was talking to youth today, said, I tried that text line. I really wanted to talk to somebody, no one's available, and they wouldn't talk to me. They just wanted to text. And other youth will say, oh, the text line, you know, is really able to communicate what I needed to through text. So we really want to support youth in figuring out what is the way they prefer to connect with someone to be able to talk about these things. And we go to the next slide. So our agenda tonight, I think the program will run somewhere around 30 minutes to 40 minutes, and we'll have time for Q&A and to share a couple of handouts that you can print for yourself and have as a reference at home. But it's really about helping your children and helping our students. And so the basics of youth suicide, really, they focus on, Forefront uses an acronym called LEARN, and the SOS program uses ACT, Acknowledge, Care, and Tell. And that applies to anyone. It's the format we use as counselors. It's a format we hope you'll use in supporting your youth, or perhaps friend of yours child. And also, what can you do when your child acts, how to support them, how to build coping skills for your child, for their friends, and what resources are available. And we go to the next one. So why does suicide happen? And this is a question we're often asked, and that we work really hard to help parents understand what's going on here. So it's really about trying to stop intense emotional pain. And when our youth or adults are in distress, unfortunately, many people's surveys I've seen say about half the people, 50% of people who have been respondents to this said they thought about suicide at some point in their life. And this was of people 14 to 21. And it's an older study. And I think it's even more prevalent today. And next, please. So untreated depression is a major cause of suicidality. We know that prior to COVID, about 20% of youth between the ages of 14 and 24 will experience a depressive episode at some point in their life. It might not be now, but it may be as they get into later teens. And we know it's a significant issue for youth in college. And we know that the overlay of COVID has really intensified these feelings of isolation, and especially for our middle schoolers, one of the core activators of suicidality can be thwarted belongingness. It's very difficult to have a sense of belonging when everything is remote, and also a sense of perceived burdensomeness. And I know it's been a huge challenge for many people. My children are out of the house and have been out of the house for years, but trying to manage work, trying to manage your children being online. And we hear from kids that they feel like their parents would just be better off if they weren't there, because it's just been so demanding and taxing on everyone. So we also know that oftentimes mental health issues go untreated for an average of 8 years. So the sooner you can recognize that your child needs help, the sooner we can get involved or refer you to places that they can get the treatment they need and get back on a healthy developmental track. Next animation, please. So substance abuse, we know that substance abuse can be a major component. It's a disinhibitor. It's a depressant, and that's often a shock to kids because they see these commercials for all kinds of beer and different things. It looks like it's a big party, and they really need to understand that using alcohol, especially, it's a depressant. And if you're depressed, it's going to make you more depressed, which really confuses kids sometimes. Next animation. And then isolating, withdrawn. Here we've had this forced isolation. So I think that's, we're starting to hear kids come back to school and starting to share with us, teachers, in writing, how difficult this has been for them. And fortunately, we're there to catch them, but we need your help with this as well. Next animation. And then that loss of hope and just that hopelessness, we know, is one of the core ingredients for somebody feeling distress, not thinking that things are going to get better. And so we need to support our kids in believing that there's a pathway out of this. Unfortunately, we're getting closer to it, but these are real keys. The next animation. Access to weapons. We know that lethal means, so access to guns, lethal means we're not here to tell you not to have a gun. We're here to tell you to be safe with that weapon. And Forefront has a huge program on gun safety. Safer homes is what they call it. It includes gun safety, getting rid of meds, unused meds, because we know when people have access to means, it heightens the possibility of suicide. In Washington State, I think it's more than 50% of suicides are gun related, and they're guns that people have in their home. So it's a significant factor, and want to make sure that you're safe. And we're happy to refer you, if you need a gun lock, gun safe, where you can access those. And the Mercer Island Police are a supporter of that project as well. The next animation. And then thoughts of suicide. So students writing things about suicide, thinking about suicide, and kind of this suicidal mindset, I really can't emphasize enough. And unfortunately, we've had, fortunately, we're there, but unfortunately, we've had several students coming to us with suicidal ideation. And it's really, and students will say, it's not that they want, I don't think I've ever heard a student say they want to die. They say they don't want to be around anymore. They say they can't take the pain. So we need to understand that it's about being in distress. And when they are that distressed and upset, this comes to their mind. We talk about a suicidal curve. We know, help them recognize when these emotions are building up, what happens when they get kind of that apex of the curve. And then there's that downside, and they already are doing things because they're managing this somehow. So we really support students and families and recognize what skills they already have, what's working to keep them in a place where they're not acting on that suicidal ideation, where they can get back to calm. Oftentimes it involves a pet, it involves YouTube videos, it involves connecting with friends. So we need to think about, how do we allow students to have the connections they need, but manage that in a way that maybe they can have their phone. I'm thinking phones especially, they can have it to whatever the bedtime is, 9 o'clock, 10 o'clock, but then it goes with you, so they don't have it all night, but they still have an opportunity to connect with friends if they need to and not be more isolated. All right, next slide. So how can we prevent suicide? And we can go through the animations here. We'll go to the next one. So you play a key part, treatment for depression, helping your children access the support they need. We are all aware of many referral programs and can help connect you to therapists who have availability, programs that support what your child's specific needs are. Oftentimes it starts with a visit to your pediatrician and checking in with them and getting an understanding of what might be going on, because there may be other medical issues that might be contributing to the depression, and we need to rule that out. We've had kids who've had diabetes that parents didn't know about that, or other issues that might be influencing their mood disorder. Next animation. Healthy habits, really reinforcing very specific things. Getting enough sleep. It's called a toolkit on this website called Erica's Lighthouse. The toolkit is getting enough sleep, good nutrition, positive coping skills, right? So modeling for your children how you manage stress, whether that's taking deep breaths, if it's using meditation, going for walks, getting exercise. That's the other one, getting physical activity. So we can talk to our kids about what they need to do till we're blue in the face. What we really need to do is model it, model it, model it, model it. Demonstrate for your kids and highlight You get upset too, you can get frustrated, you can get sad, but there's a pathway out of that. And next animation. Connection to peer and trusted adults. I heard the head of Children's Hospital Behavioral Health talk in a meeting that our children are missing the secondary connections to adults in their lives. And so returning to school is so important, but supporting your kids and making connections. Our kids kind of had a surrogate family. Both of them had different families that they would connect with, which is harder now than ever, but supporting those connections. And next slide, or next animation. Again, the coping skills, really modeling them and recognizing if your child doesn't have any, turning to us and we can give you all kinds of resources for those. In the next animation, preventing, again, access to means. And guns comes up here because it's so prevalent, but also medication you may have in your home. You may think that your child doesn't know where they can get that medication. I think there's some stat that we have. It's like 80% of parents don't think their kids know how to get the meds, and 90% of kids know exactly where the meds are. So it's important to put those away. You can get lock boxes and especially get rid of unused meds that have expired, you know, that are left over from some other event, maybe in your life, pain meds especially. And also to be aware that ibuprofen is the #1 medication that kids will turn to. And that's from what am I thinking of? Well, the program that's really about getting rid of medication. So, you know, those big jars of ibuprofen that we get at Costco, they need to be put someplace safe that your kids can't get access to that. And the next animation. And then feeling of hope. And it may be sharing with your child challenges that you've been through, not projecting your experience on them, but sharing that you've been through some tough challenges as well. And there's a pathway out and things will get better. And a little bit of perspective taking. Middle school is a very small part of their life. If I often show them, spread out my arms, I say, here's your life. This is middle school. I did have a child measure for me exactly how big middle school represents, but it's really a small part of their whole life. So help them have perspective. Okay, next slide. I'm passing it to Janet, I think.
Yes. All right. So now we're going to talk a little bit more about how your child has an important role in supporting friends possibly who are going through a hard time. And you as a parent also have an important role in empowering your child to be able to support their friends or being able to support your own child who might be going through a hard time. Next slide. So we're going to talk about a model that is being taught to students in the school. This year, we've really been concentrating on overall mental health and well-being with students, but typically we do teach ACT to our students. We actually have posters up around the school that talk about ACT. And so we're gonna, if you wanna click through this one, we'll talk about what ACT stands for. It's an acronym, and A stands for acknowledge, and that's where you're going to either be able to identify the signs of depression or suicide in a friend if you're a student, or also for parents. Care, this is a part that our teens are super great at, showing that they care about their friend. And then the T stands for tell. And this is really one that we really have to work on with teens, because a lot of times they don't necessarily want to talk to an adult, and so they have a harder time coming forward. And we really, really want to encourage them to seek out an adult or a trusted adult. Some at the school, it could be a parent, but knowing where they have limitations to support someone who's going through a really hard time. And as parents and caregivers, you play an important role in this messaging, because you may be the trusted adult that a student or a kid comes to. And we want you to be able to have the tools when and if you have to have that conversation, either about your own student or about a friend of theirs. Next slide. So we're going to kind of dive into each one of those acronyms separately. So this one is the A for acknowledging the warning signs, and you can see the warning signs here. Typically, a lot of people think of suicide and they think more of sadness, but actually anger is a lot of times how it's presented. And, we all have anger at times, but this would be anger out of the ordinary. So that could be a much more heightened level of anger compared to what the trigger was. But, bigger than you would normally see in a student. The next one is big changes in behavior and withdrawing or isolating from family and friends. And this can be hard because teens definitely can pull away some and want to spend more time alone. And so all of these, you might say, well, I've seen that in my teen, or that seems pretty normal. It's more common in combination and in the extremes. So declining to maybe see friends or do things that typically were something that your child enjoyed doing, or they see that in a friend, changes in interest, like out of the ordinary. The next one is hopelessness. This would be being down, loss of the current, like hopelessness over the current situation or the future. This is where you can hear kids say things like, what's the point? Nothing matters anyways. Sleeping more or less. So that could be having trouble falling asleep, waking up a lot when they are asleep, sleeping more than usual, sleeping at odd times, really using sleep kind of more as an escape. So if you just feel like you're seeing a teen sleeping a lot more than they usually do or less, that would be a warning sign to think about. Harry touched on drinking and drug use. It's often used as an escape from reality or to manage feelings. So definitely something you want to keep an eye on. Overwhelming pain or sadness. This can be like from a significant transition or a traumatic life event that's very overwhelming. And obviously we've all just been through and are still dealing with a pandemic. So it's been very traumatic for some people. And then the last one, talking about suicide. It's really important to talk about suicide seriously. This can be statements like, my life would be easier if I wasn't here anymore. Those are really big warning signs, and we take them very seriously if a student comes to us saying that they have a friend saying suicidal statements, or they themselves are saying it. Next slide. So this is diving in deeper to care. And this is important that students are learning to listen to their friends and show that they care. We encourage students to do active listening that can be both verbal and nonverbal, just really telling someone that you are there for them. These are some examples of statements you can say. It's okay to feel that way. Tell me more about that. I'm here for you. Another one could be, thank you for telling me. It can be really scary to share that with someone. And it's hard as parents, especially, to hear those kind of statements and listen to that type of pain. And so just letting them know that you're there and you're listening and not necessarily there to fix it. It's natural to want to kind of explain away these feelings or to think of ways that the person can feel better, but a lot of times what they need is someone just to listen. Okay. Next one. And this is the one that students really need to be encouraged to think of adults in school and out of school. So that can be you as their parent also, that they can go to in times of distress. And we really emphasize that kids need to come to us and as adults when they need help. And it can be hard because a lot of times when someone is in a dark place and feeling suicidal, they might say to their friend, I don't I don't want you to tell anyone. I don't want to worry my parents, or I don't want to worry my teachers. But these are things that really an adult needs to be involved in and helping support them through that. And so we really emphasize that it's not a secret you can keep, and your friend might be mad at you for a little while, but you are saving a life, and it's very important to go and get help for them. Next slide.
Okay, so I'm going to talk a little bit about the role of a parent. If you find yourself in a position where you are the trusted adult, where a child is confiding in you that they're worried about a friend, I think it's really helpful to think about how you would want some other adult to respond if it were your child in danger or in need of support. And I think that might help with perspective as far as how you handle that. But Janet mentioned this, of course, one of the most important things to do is just listen and hear them out. And it definitely helps to reassure them that they're doing the right thing by telling you, because together you can help save a life. It's obviously better to be safe than sorry, and to work together to figure out a plan for moving forward and communicating with that child's family. So definitely know that connecting with that family is absolutely the most important thing to make sure that child stays safe. If you feel like the child is in immediate danger, and we've definitely had cases like this where something has popped up over the weekend and parents find out it's not a situation where there's necessarily time to contact the school to get get support from the counselor. So know that calling 911, they will do a well check, and even if it's found unwarranted, you've done the right thing by getting eyes of a professional involved in the situation. So know that your job as a parent is to take all of the concerns super seriously and make sure the people who's the parents of this child in need really have that support. And there's some graphics, Michelle, if you could click. As a parent, it might feel overwhelming and scary. Of course, there's a lot to think about. You think about your own kid and the risks and the fears you may have. And so just, as a reminder, you do have a support system too, as an adult. Definitely, we encourage parents to connect with the family pediatrician if there's ever some guidance needed. As a school counseling team, we are more than happy to be of assistance. Unfortunately, or fortunately, we have quite a bit of experience in this realm where we've worked with students and families who have expressed suicidal ideation. So we do know the best plan of action. And then, like I mentioned, for immediate concerns, 911 is the thing to do. When we meet with the students and we teach lessons on this subject, we most definitely encourage them to put those 2 contact numbers in their phone. And I would say, as a parent, we encourage you to do the same. If you need support, it might be something that you do with your child to get the help of a professional. If it's not, a school counselor during the school day, there's a lot of support available. And, we just want to make sure that your child understands how very serious this is, but how very supportive you are going to be. Okay, next slide. So as a parent in this moment, you're not expected to be an expert. You won't necessarily have all the answers. Even us as professionals, some of these conversations are hard and they're emotional and they're tough because there's somebody's, you're trying to, in your head as an adult that there's so much life in front of these young people, but sometimes they can't see it. They get in their own way. And so, you want to just take some deep breaths and be calm and remember that you're human. Graphic, please. So give yourself permission to feel all the feels. I think when I work with students and families, I always advise to be genuine. If you're overwhelmed and it feels really intense for you, it's okay to talk about that, to model the behavior that we're going through this together and I'm scared and I'm concerned and I really understand the importance of taking action. And of course, the first thing to do, of course, is to assess the imminent danger. Is somebody's, at risk in the moment, and that's when you call 911. But if you have some time to process, find a support network for yourself as an adult. You can reach out to close confidants. You can talk to the school, again, the pediatrician. There's other folks who have been through these kinds of things who can offer professional support. And then Most importantly, just as we would tell the kids, this is not a secret you can keep. We as counselors always talk about limits to confidentiality. And the number one thing is if somebody's in danger of hurting themselves or someone else. And so when you know that somebody is potentially thinking of hurting themselves, it's important to take action and tell someone. Next slide, please. So as far as protecting your own children, we really always encourage connection, getting your kids involved in activities. I was sort of thinking about our kids' lives as like a big web. And the more connections they have, the more likely you are to be able to access supportive people if there are warning signs, if they notice a change in behavior, if there's something that they feel is warranted to bring up to the family. The more eyes you have on your child, the more likely you are to be informed if a concern arises. So think about that. And of course, I'd be remiss to ignore that we're in COVID. And so having these connections is a little bit harder than normal, but it is all the more reason to stay connected to your child and have some conversations, have open dialogue. And I believe in the handout that we're going to share at the end that there are some conversation starters. And we also mentioned that kind of thing in our counselor newsletter. So just, keep that conversation open and remind your child that you're there to listen. Next graphic. You said that. So if, and again, just remember that nobody has to go at this alone, and there was an incident today at school even, and Harry and I partnered in working with a student. We are professionals and certainly capable of meeting their needs and working with students, but we also like to operate in a supportive network. And so I think, back to Harry's point before about modeling, I think the more you can model protective factors as an adult, the more children learn from seeing that in action. Like, oh, I see mom and dad talking to friends on the phone and confiding in them. That's something that maybe I want to internalize and add into my my daily activities. Okay, next slide. And then furthermore, just, working with your child to build coping skills. This has been an incredibly difficult year. And I think we've been tested in new ways. And, we just want to take a moment to remind you that, again, modeling your own coping skills in times of distress, practicing self-care is something that kids see. If you're really worked up and frustrated about whatever, do you take time to walk away and to go find a way to reboot? And certainly as the kids get older, we talk about this in our lessons all the time at school, but as even in your homes, it's important to remind kids to build a toolbox. If you've tried something once and it doesn't work, try something else. And there's going to be some examples we can share with the graphics at the bottom, but these are obviously really pretty standard examples of coping strategies. If, in times of frustration, you can encourage your child to go for a run or go for a walk in the neighborhood, take the family pet on a walk. I've heard a ton of examples of that during COVID, just a reason to get out of the house. But that fresh air can do a really big job in trying to help people calm and get centered. And then another thing I think that's been, again, something really highlighted during our time at home is just focusing on some positivity and gratitude practices. What can you do to help your kids recognize the strengths that they have and the things that they have that are positive? And then again, thinking about that web and that connection to others, friends, family, activity, people. And then definitely kids in the middle school realm are very savvy when it comes to technology, more so I think than any of us on this call. But they might turn to music to listen, to just decompress. And then, obviously we have Netflix, we have Minecraft, we have endless things to do online that is a good distraction when things are hard. And, hopefully those strategies and coping skills will help kids be able to deal with their frustration, vent a little bit, think about some positive stuff, get some endorphins, and then carry on and regroup. And so it's a really helpful talking point. Something to take away from this evening is to maybe talk to your child about what coping skills are working. And probably that has come up over the past year. I'm sure I can only imagine how many times parents have heard, but mom, dad, I'm bored, right? We've been home a long time. So just maybe revisiting and getting creative with that coping skills and modeling what you can to help expand that toolbox. Those are all things that help.
All right, so I'm going to talk a little bit about talking to your teen. So we've kind of covered all these different pieces about listening when your teen does come to you. But sometimes some of you may be thinking, but my teen doesn't come to me and talk to me. I certainly was one of those teens who did not talk to my mom. And I don't know why. She was actually, you know, an incredibly supportive mom, but I was one of those teens that didn't think so. So it's taking the time to have the conversation, and that can be hard. We think about, you know, when somebody like breaks their arm, it's really easy to just be like, oh my gosh, how's Gina doing? I heard she broke her arm. Is she doing okay? What was the treatment? But when we're thinking about mental health, and we maybe know that somebody in our lives or in our child's lives is going through a hard time with their mental health, it can feel really hard to have that conversation. And it can feel hard to have that conversation with your own teen. But I was really thinking about some of the students I've been meeting with recently, and some of them feel like they're worried and concerned about telling their parents about how they're feeling. I was thinking about it before this presentation, and I think that they are ready and wanting to talk to their parents. They just don't know how to do it. So if you can open up the conversation, you may get some results that you weren't maybe expecting, but it can be really, really powerful to just say, hey, we've had a really hard year. You're in middle school. You know, I want to talk about how you're feeling and let you know that if you're having really intense feelings, that's okay. We need to think about that depression is not a character flaw, and you know, it's something that we need to be able to talk about and listen to our teens about how they're feeling. So the slide is, you know, talking about open-ended questions. We've talked a lot about teens just want you to listen. That doesn't mean down the road you can't help them problem solve, but in the moment, you could even ask, if they've come to you, you could say, do you need me to listen right now, or do you need some help problem solving? And so even talking about what do they need in the moment, instead of kind of jumping, we as parents really want to jump to problem solve, and just being available and letting them know that you're there at any time. And, you know, I've heard from parents before, like, when their teen has come to them about worries and concerns, it can be, you know, at the time when you're the most tired, or you're like, I just sat down to watch my favorite TV show. But they will come to you if they know you're available. Next slide. So then when we're talking about opening that conversation about mental health, if that conversation does lead to you really being concerned about what they're talking about, you know, if they're saying stuff like, you know, I feel empty, I feel depressed, I feel sad all the time. Those are really big warning signs, and being really attentive to what the different things they're sharing with you are. And it's okay to ask about suicide. It's really hard to do, but you will not put the idea in their head. So asking about suicide, asking, have you thought about killing yourself? Have you thought about killing yourself? Will not put the idea in their head. And actually, it can show them that you recognize how much pain they truly may be in. This, of course, is, you know, through imagining a conversation where you've opened up the dialogue about mental health. I don't know that you open a conversation with, you know, have you thought about killing yourself? You've already opened the dialogue about, you know, how are you feeling these days? You seem sad. You seem isolated. If you've seen all of those warning signs that Janet was talking about, it's okay to ask the question, and you should ask the question. Next slide. Oh, so these are indirect questions. So we encourage you to ask direct questions. So the indirect questions are, do you wish you could go to sleep and not wake up? Do you wish you were dead? And more direct questions are, have you thought about killing yourself? Have you had thoughts about suicide? So being direct is really important. You will get more direct information by asking the correct question that way. And then tips for getting teens to talk. And I'm not going to read the slide to you. Every teen is different, obviously. But I do think that those opportunities if you're on a walk, or if you're somebody who likes to garden and you've been able to get your child into gardening, activities like that, or cooking, those can be really great opportunities to open up that dialogue with mental health. And it's not to ruin the moment. I even had a student say, well, I don't want to talk to them during the times we're having fun, because then I think they'll be really sad and I don't want to ruin the fun times. And so think about that. If you opened up the dialogue, then you may get so much more information and confidence and trust from your teen. And it's kind of a nice distraction to have an activity that you're doing while you're, having this potentially difficult conversation. So it's just finding the right times. It says taking a drive. I kind of thought about that though. And I was like, I don't know if I want to be trapped in a car with my mom, like when they're opening up that conversation. But for some people, that's like the best time to have a conversation with their teen. So it's really figuring out what's best for your family. But I think the biggest takeaway is knowing that you can open this dialogue up and talk about their mental health. You can talk about your own mental health. Just like I think one of Janet, somebody was talking about, talking about your own experiences. It was Terry, I think, not projecting your experiences, but just letting them know, like, I've had, a really hard time at these different times. And I know if I'd had somebody who was willing to listen and support me, I would have felt so much better. So the key takeaway for me on these slides is finding a time to talk to your teen and letting them know that it's okay to talk about how they're feeling, and that if they're not feeling okay, that it's okay not to be okay. Oh, I have this one too. Action steps. So looking out for warning signs and seek help immediately. Help build coping skills and positive supports for your child. Easier said than done. But sometimes I think what's hard for everybody is the coping skills are simple. We want it to be, we think that it should be so much more complicated because they're hard to continue to do, because you have to remind yourself to do the breathing, to do the exercise, to eat well. But if you chunk it out, they are simple, doable things in our lives, but we have to work really hard to do them. So helping them build those positive coping skills and supports for your child, and then talk to your child about suicide and be ready to listen when your child acts.
So all of us are trusted adults on this call together tonight, and this graph is really showing that together we can all make a difference in a kid's life, whether it's a friend or your own child. So this is showing the two leading causes of death for teenagers. The first is accidents, and the second is dying by suicide. And it shows that 15 years ago, the accident rate for teens dying was really high. And over the past 15 years, there's been a lot of things that have changed, right? We have stricter licensing requirements, driver's ed that we probably all hated going to, stricter drinking and driving laws. And over the 15 years, we've lowered this rate of teens dying by accidents. And so our hope with all of this information tonight is in the next 15 years, we'll see this suicide line start to just decline more and more as talking about suicide with your own kids becomes less stigmatized. For friends, talking to friends about their mental health also becomes less stigmatized. The hope is that this graph in the next 15 years will really start to plummet down. So next slide. And tonight there's been lots of information, and just to normalize, if you're feeling any sort of overwhelm or you've seriously been taking notes, there are lots of resources and people to turn to if you have questions. So the sossignofsuicide.org/parent has a lot of great information. There's videos, there's posters, and there's also a great screening tool. So if after tonight you're thinking maybe your kid at home is having any sort of depression, there's actually a screening tool. One of the questions is shown here. So in the last 4 weeks, has it seemed like nothing was fun for your child and your child is just not interested in anything. So it's a series of those sorts of questions that you can answer, and you'll get your results, which will help maybe direct you in a different way to start having these conversations or ways to intervene. Next slide. So this is a summary of ACT. Again, this is a really important skill to take away from tonight. And on that website we just shared, you can even print this off as a poster. You could have it on your fridge as an entryway for conversations with your kids, and just as a reference, because like we said, sometimes these conversations can bring up our own emotions and sometimes can be really difficult. So it's all about acknowledging that you're seeing signs of suicide, showing your child that you really do care, and then making sure to tell a professional. And all of us 5 counselors on this call, we have our information on our website. You can always get a hold of us via email, via phone. And there's also tons of other references and referrals that we can also give. So we just wanted to end tonight, the next slide, sorry, by thanking you all for taking time to show your care for whatever brought you to this training. Parents play such an important role in whether it's your own kid's life or maybe a friend's. And as a school community, we're working really hard to initiate these conversations, and we know you're all working really hard to do the same for your kids. And we just shared a lot of information, and we would love to open this up for any comments or questions. And I'll hand it over to Harry of how to navigate the question section.
Thank you, Audrey. So that last slide is one of the handouts one of the PDFs that are in the chat. And there's actually another one also that's Learn to Act, and it's really more specific on how you can help your child, and really going back and giving you the information that we've been talking about, specifically about how to engage with your child if they're concerned about, or you're concerned about them, or they're concerned about a friend. And I think that Drew really touched on it too. And when we're talking to our kids about intense emotions like this, we need to pause our desire to fix it. Because if we rush into fix, we often don't hear everything that they have to say, and they can inadvertently, we can invalidate how they're feeling. So we really need to pause our desire to fix and really hear how they're doing. And again, go to, like Drew was talking about, let them guide the discussion and wait till they're ready for you to engage in some sort of problem solving or thinking about what next steps are. So both of those, I encourage you to download those and print them. I think they're great information. And Tammy had put something in the chat, as we had talked about, the opportunity this weekend to dispose of any unwanted or expired meds. And Youth and Family Services has free lockbox for the community. It looks like you can click on that link to get information about that as well. Thanks, Tammy, for putting that in.
Just a reminder, if you do have a question, if you can put that in the chat, that will help us keep track of all the questions. This is all really wonderful information. And I know from participating in Forefront, I really appreciated that trying to say those words of, are you thinking about suicide? If you have to say it for the first time, it's so difficult. And practicing it made it a lot easier to say and made me more confident. So I think that was a really important tip, because in the moment, it's really challenging to say. But knowing that we are having so many kids struggling and that people are seeing increased rates in suicide, this might be a whole nother training, Harry, but do you have any advice, or how do people approach maybe families or friends that they know who have had children who have attempted suicide? How do you work through that with your kids? And that might, like I said, it might be a whole nother training, but kids process it in a whole nother way. If they find out that one of their friends have attempted, how do we help our kids through that, or ourselves through that, for that matter?
You know, it's a really good question, Michelle, because I think part of where we need to start is being non-judgmental and really talking about what we know and thinking about that person must really be in distress. They must really be hurting to have made a choice like that. And it's that piece of really thinking about the complexity of all of this and not making a judgment about anybody for what they've done, but thinking about how we can be of support, and that we also need to make sure that they're connected with somebody who's there that can support them, a trusted adult in their life, and to get the resources they need. And we really often go back to youth or to other families and let them know that we followed up and that we're making the connections that can support that person. But it's really a challenging time, and I think we got to be careful not to stigmatize what's going on for people anymore, and that so many kids can feel this. And I think part of what needs to happen initially is to hear our children and let them know that we can appreciate what their experience is and that they're not alone, and other people felt these things as well, and not to necessarily normalize it, but to make it okay to talk about it. And it's really that destigmatizing that opens the door, that can really create the connection we need to get the help that the child needs.
I know, Harry, we had talked about that kids are going through some really interesting and challenging times right now. Just parents are trying to figure it out as we go, and kids are trying to figure it out as we go. And are you, as a staff, seeing that kids are adjusting to the change as well, or are the changes bringing some additional challenges or anxieties for those kids, that because once again their life is changing drastically as they head back to school? And what do you foresee as kids head back maybe full-time in the fall?
I'm going to open that up to one of our other team members.
That's a great question, Michelle, but a really big question. I think I think I speak for all of us that we're seeing a huge variety of experiences right now. We have some kids who are thriving, and online school has been a dream come true for some who just maybe have social anxieties or things like trouble concentrating in a crowded social space. But then we definitely have kids who are super lonely and isolated. We have kids who are home full time and haven't been able to socially interact with somebody their age in over a year. You know, we've had some kids incredibly grateful to come back, and they're thrilled, and we've seen incredible improvements in their mood and their affect and their engagement at school. But then, you know, we've had a number of students visit our offices in tears, you know, so I don't know that there's an easy answer. One thing I know that has come up a handful of times for us is the concern about coming back to school if hopefully full-time in person next year. I personally anticipate an uptick in some school refusal, breaking the habit of being at home and having to walk through the door and deal with potentially the social interactions that have been, you know, minimal to null over the course of the pandemic. You know, so I think some kids are going to have a really hard time coming back and being expected to be in the classroom for the amount of time that, you know, prior to this experience, we just took for granted, and it just was what it was. But now we've had pretty much a year at home. And so I think coming back to in-person learning full time, I predict we'll have some complications for a handful of kids, at least. Anyone else?
I just think to build off that, that's why it's so important to try and start building that dialogue with your child, even if they're seemingly, you know, adjusting beautifully to the hybrid model or whatever's been going on. Just letting them know that you're there to talk if they want to talk, you know, letting them know if they're worried about a friend, they can talk to you, or if they're worried about themselves, they can talk to you. Because what I've noticed is some of the students that I'm meeting with now, the feelings that they have right now are not necessarily new. They just haven't had the opportunity to connect with us in person. And a lot of them wanted to be able to do it in person and not over Zoom due to, like, you know, where their space is for talking to a counselor, in case they worry, like, will somebody overhear me? And so unfortunately, then some of this stuff is just like built up through, you know, the loss of the time in school. So I would agree with Jana. We're seeing a huge spectrum of different things throughout this very traumatic experience we've all had. But I've also seen so much resilience and I think that's another topic you could talk about is, how do you continue to bounce back from a really hard time? And that, yeah, we're having a really hard time, but what do we do to bounce back from that? And that's all those pieces of coping skills and optimism and support network. We think resilience is just innate, but we can actually build that muscle. So.
Thank you. And I think I was thinking about what Harry said about middle school is just one small piece of the student's life. I've almost had to remind myself during COVID, that's right, this isn't going to last forever. Something will change, something will be different, because it feels almost, when the day-to-day is so similar, it feels like this could go on forever. And so I can imagine if you're in that time period of your life, it feels like this is going to be forever. So yeah, something for us all to keep in mind. I did in the chat include the 2 handouts that the team had talked about, as well as a link to all of our wonderful counselors that we have in the schools. So if you're looking for the counselor for your particular student, you can find that in the chat. We're just so fortunate to have such wonderful counselors and resources in our schools, and especially during this time, I don't know how we all would have gotten through without. So any last questions before we wrap up for the evening, or anything else the counseling team wants to share?
I guess I would just encourage people to reach out to us. And if you have some feeling, some intuition that there's a concern about your child or someone else's, let us know, and we will pursue that and support you and that child as best as we can.
I think that's a great point, Harry, because I have actually called the counseling staff based on my concern for other students. And I always understood that the counseling team could not share any details with me, but you were always appreciative that I had reached out with concern. So I think sometimes, even if we don't feel comfortable telling the student's parent, it's upon us to talk to a trusted adult as well. And so I would encourage people, if you do have a concern about a student and you don't feel comfortable talking to that parent, reach out to the counseling staff, and they are able to reach out to that student and provide the support they need. So it's a good
100%.
reminder.
Yeah, absolutely. And we just want to thank you again, Michelle, and Parent Edge for making this space for us to share this information, because we really need to put together a partnership. I like that web that Jana was talking about, and it's really a web that's a safety net. And it's there for us, and it's there for our children, and we need to utilize it, but we need to engage in creating it to make it effective. So thank you.
Yeah. Well, thank you all. We appreciate you being here tonight and taking time out of your evening. You know where your resources are now, and please don't hesitate to contact any of our counseling staff if we can be of assistance. We do have a great list of resources on the MI Parent Edge website. If you look under resources, there's everything from COVID resources to suicide prevention, all sorts of different links and resources that we hope you will take advantage of as well. So thank you all, and have a great evening.